if you're doing zirconia type restoration, so oxide-based ceramics, the way we prepare the inside of a zirconia restoration is with air abrasion. So we're going to use something between 30 and 50 micron aluminum oxide, and we're going to air abrade the intaglio of the restoration. This, by the way, is exactly how we would prepare the inside of a metal ceramic restoration or an all metal restoration if we actually want to get some adhesives between the SpeedCEM Plus and the actual restorative material. Now, if you're doing lithium disilicate based restorations, those are etched using chemistry. And there's two ways to do that. We can do traditional hydrofluoric acid at 5% for no more than 20 seconds, or we can use an Ivoclar Vivadent product that's called Monobond Etch and Prime, and it's a self-etching silane. So depending upon the restoration material, you have different ways of preparing the actual internal of the restorative material. So now that process can be done either before or after try-in. That's your preference. But when the restoration has been tried in after the restorative material has been prepared, which I think is for most of us how it's going to happen, because the restorative material is being prepared most likely at the laboratory. That's something we should confirm with our lab so that we know how they're handling it. We're going to try the restoration in, whatever your process is. You're going to check margins, contacts, all of those things. And then what we're going to have to do is we're going to have to clean the inside of the restoration to get back to that prepared surface. And for me, my preference on how we clean is a material, again, from Ivoclar Vivadent that's called IvoClean. So it's a phosphate-free restorative cleaning material, so it can be used on metal, oxide-based ceramics like zirconia, and on lithium disilicate. So you're just going to vigorously shake the bottle. You're going to apply it for 20 seconds minimum, so between 20 and 30 seconds. Rinse it and then dry. And I do recommend that you use a clean, dry air source. So if you have an A-deck air dryer or an isolated air line on your unit, that's the best way now after you've rinsed your IvoClean. Now, one of the advantages to SpeedCEM Plus is if you're working with zirconia or an oxide-based ceramic, you do not have to do anything on the inside of the zirconia other than the air abrasion and the cleaning, because the chemistry in the SpeedCEM Plus will go ahead and prime or condition the inside of the zirconia. Now your restoration is handled. Now what are we going to do on the tooth? Well, one of the advantages to a product like SpeedCEM Plus, the reason we put it in our self-adhesive resin category, is that really we don't have to do anything to the tooth. So we're simply going to clean the preparation, whatever your preference is for cleaning the preparation. I like to actually clean the preparation often by doing a little bit of light air abrasion and then just cleaning it off with like a prep scrub that's based on 2% chlorhexidine. You can literally take like a little preppy and wet it with chlorhexidine or water, and then use like a bristle brush and a slow speed hand piece and clean the prep. But however you're going to clean the prep, you're just going to clean the prep. Then you're just going to load the restoration with your SpeedCEM Plus. And so it comes with a mixing tip. You're going to express it out through the mixing tip, load the restoration, and now you're going to seat the restoration. I'm going to cure for just 1 second at each line angle. We call this the quarter technique. So I'm going to do mesiobuccal 1 second, distobuccal 1 second, distolingual 1 second, mesiolingual 1 second. This is going to take my SpeedCEM Plus now to a really perfect gel phase. I can now go in and I can clean up all of my excess cement, really making sure I'm getting the excess out from the interproximals. Really important that you do this tack cure on the line angles, not just buccal and lingual, or you'll leave a lot of material that doesn't reach the gel phase interproximally.